Instead of shooting zombies, I laser endometriosis and help patients get pregnant.
Hello! Tell us who you are.
Hi, I'm Dr. Debbie. I'm a gynaecologist specialised in minimally invasive and reproductive surgery.
First thing first, does every fertility problem mean you need IVF?
Not necessarily. Many couples just need to get checked, get the right diagnosis. Sometimes it's medication, sometimes it's a simple surgery or procedure, and yes, sometimes it's IVF.
Oh, what are the common reasons that couples struggle to conceive?
Well, think of it like a team sport. Sometimes it's the egg team that needs help. Sometimes it is the sperm team. Sometimes it's both. So the usual suspects, endometriosis, cysts, fibroids, polyps, blocked tubes, hormonal imbalances, and sometimes sperm issues. Come, let me take you for a walk.
Your appointment tomorrow.
Okay, patients are coming. Thank you, Ida.
So, Dr. Debbie, how do you find out what's wrong?
Step 1, do not panic. Step 2, simple tests. For the lady, it's blood tests to look at the hormonal profile. Ultrasound to look for fibroids, polyps, endometriosis, that could be the root of the problem. And number 3, tube patency tests. That's when we check if the fallopian tubes are blocked. And for the gentleman, a simple sperm test.
So, what if you find something like a blocked tube or fibroid? Then what?
That's when minimally invasive surgery comes in play. What we do is with small incisions, we can put in instruments to remove the growths of cysts, endometriosis, or fibroids. I look at it like a house renovation, where you don't need to tear the house down, but we renovate the place and make it more a better environment for the baby to live in. Let me bring you to the ward.
You mean you can just fix fertility issues with a scope?
Exactly. Let me explain to you. For problems inside the womb, like small fibroids or polyps or septum, we put in a small camera called a hysteroscope and remove whatever the problem is. And for the outsides, where there is fibroids, cysts, endometriosis, we do laparoscopy or robotic surgery. So it's like sending a drone with a mini camera, minimal mass.
Robotic surgery? What's that?
The robot is like my sidekick. It makes my surgery more precise and more gentle. And this is very important for fertility-preserving surgeries. Aifa, how is Shamira doing?
She's doing well.
Okay, come, let's go see her. Hi Shamira, how are you feeling?
I'm good, very good.
Very good, no pain? Very good, so you can go home and I'll see you back at the clinic next week. Right,
so much, Doctor.
Good for you.
So, Dr. Debbie, for fibroids, must it always be a surgery?
Not necessary, we can microwave them.
Microwave? Isn't it like cooking the womb?
Not the womb, but the fibroid and its evil twin adenomyosis. So we use controlled heating and ablate the fibroid and adenomyosis so the womb remains intact for future fertility. Come, let me bring you to operation theatre.
So what's the biggest advantage of all these methods?
Smaller scars, less pain, quicker recovery. And another important thing, lower likelihood of organs sticking together after surgery, which is very important for fertility.
The reproductive organs can get stuck?
Yes, we call them adhesions. So they're kind of like melted cheese on pizza slices after surgery. So that's why I always use adhesion barriers. They are kind of like a non-stick coating for your inners. So if you ever need surgery, do ask your surgeon if adhesion barriers will be used.
So this is your surgeon look. So Dr. Debbie, how do couples know if surgery can help or if they should go straight for IVF?
That's when consultation is important. See a fertility specialist. We will ask some questions and do some simple tests and scans to find out what is the underlying issue. So yes, for some patients, IVF is the answer. But for many, either medication or some simple procedures or surgeries to treat the underlying cause.
Got example that someone avoided IVF thanks to surgery?
Yes, many. I had one patient that had blocked tubes from endometriosis. We went in for a keyhole surgery and got it fixed. Few months later, she came back with morning sickness instead of pain.
Nice! Honest question, are these surgeries painful?
Yes, after surgery, there'll be discomfort, but with minimally invasive, the scars are smaller, therefore less pain, quicker recovery. So for my patients, they walk around in the room on the same day after surgery. So with small incisions, now we can remove larger fibroids and cysts. So some of my patients call me a magician.
Wow, this machine looks cool. What is this?
This is the surgical robot that I mentioned earlier. It's not operating on its own, okay? I control it. It just makes my surgery a lot more precise and gentle.
Oh, so you're basically a gynae gamer lah.
Exactly. But instead of shooting zombies, I laser endometriosis and help patients get pregnant. Best game reward ever.
For those watching this and thinking they need help conceiving, what's one thing you want them to know?
Don't delay in getting checked. Seek a fertility specialist because sometimes the underlying issue could be a simple one and it's treatable. So soft fertility is not hopelessness. It probably just means you haven't found the right solution yet.
Okay, so you have walked me through the whole process. But what's your favorite part of doing this work, Dr. Debbie?
It's when patients that never thought they could conceive came back, show their babies to me or show a photo of their baby. And that's when I remember why I started in the first place.